So today we want to talk about transcatheter aortic valve replacement, also called TAVR. This is a procedure that has been around now for a little bit more than 10 years. Initially, it was designed for elderly and frail patients with aortic stenosis that could no longer undergo open heart surgery. With this procedure, which is minimally invasive, with the help of our cardiothoracic surgeons, we use an alternative approach where we use usually a big artery in the leg to get up to the heart and minimally invasively replace the aortic valve. The procedure itself takes about 2 hours, so the overall length of stay is about 2 days in more than 90% of the patients, compared to previously when we did open heart surgery for about 4 to 7 days, depending on how the patient recovered. It's still a procedure that carries some risks, so the risks are similar to open heart surgery, but you do not have to deal with the scar on the chest. Important is to understand that we are doing this together with our cardiothoracic surgeons, so they always present in the room. In case of an emergency or complications, there's always the options for a bailout and to go back to a more traditional approach, which would unfortunately require still open heart surgery, but at least it can avoid complications that can potentially happen during the procedure. We have now a very comprehensive program in structural heart interventions where we not only treat aortic valve stenosis, but also treat other valves like the mitral valve, and we might expand into the tricuspid valve as well. Important to know is, I think, that we do everything together with our cardiothoracic surgeons. So as soon as a patient with aortic stenosis is identified, they can be referred to our clinic, and every patient will be seen by both the cardiothoracic surgeon and also the interventional cardiologist. And together we come up with a plan, offer both the traditional way of replacing the aortic valve and also the TAVR to the patient. And in the end, the patient has an educated decision to make in terms of which way they wanted to proceed. Initially, TAVR was designed for the elderly and frail patients, and it was now also expanded to patients with low risk for open heart surgery. So as it currently stands, anybody with aortic stenosis does have the option to get a TAVR valve instead of open heart surgery, should they choose to do so.